Good afternoon. I'm April Davis. Welcome to Healing Your Life with Sophros Recovery. We are here with the CEO of Sophros Recovery, and I always like to spell it for you in case you are wondering, what am I talking about? But it's a beautiful name. Sophros, S-O-P-H-R-O-S Recovery is the name of this facility here in Jacksonville, and they help folks who are working to recover from all types of addiction. So CEO Nick Padlo is here with us, and he is a small business leader, entrepreneur, and native of Jacksonville, Florida. Welcome, Nick.
Thank you.
And just to let people know a little bit more about you, he did receive his undergraduate degree from the U.S. Military Academy, West Point, where he served as the chairman of the honor committee. After West Point, he served for 5 years in the Army. He spent 27 months in combat operations between Afghanistan and Iraq, earning the Bronze Star and Combat Action Badge. He attended Stanford for business school, later went on to become CEO of a big company. His move into substance abuse treatment is a result of his personal battle with depression, anxiety, and substance use disorder. So he is definitely able to relate, and that is why he started his own recovery center. After getting treatment himself, he defined his personal mission as helping others through similarly dark times. He believes that everyone can find their way back from suffering and find a life free of that. So Sophros is designed to be just that place where you or someone you love across North Florida can develop a set of tools that will help you and your loved ones establish your own personal road to recovery. So again, Nick, welcome. Thank you for being here.
Thank you.
You also brought your friend. You always generally bring a friend with you. Because we like to have a good discussion and a varied discussion. So we have Elaine Simpson. She is your Director of Customer Relations and Business Development. Welcome, Elaine.
Thank you so much.
Elaine is a seasoned professional with more than 30 years in the healthcare industry. She spent part of her career as an assisted living administrator working for hospice and marketing in Jacksonville, and her background and expertise includes mental health, substance abuse, sales, marketing, admissions, administrative, management, team building, and customer service. Of course, there's more than that. She does work actively with physicians and patients, and Elaine does have her MBA in business administration, also a degree in healthcare administration. She was born in Portland, out in Oregon, moved to Cuba when she was just 6 months old, and then to Jacksonville when she was 3, and she has lived here all but 3 years of her life. So she's official. She's an official native. She has a son who's 21, and they love to watch sports together. So of course she has a season tickets for the Jacksonville Jaguars since the beginning. So she also loves turtles and travel. And so I love to know a little bit more about folks, because therapy can be, and recovery and treatment can be intimidating. And so to know a little bit more about Elaine and Nick is helpful to know that we're all just real people trying to make it through. As Aaron says, humaning is hard. So I picked up on that phrase. So we'll start with today's topic is going to be about treatment, types of treatment, and how you or a loved one can get help. So we'll start with you, Nick. I know you can talk a little bit about how long Sophros has been around and why you started it, and also what kinds of treatment you offer.
Sure. So Sophros was officially open about 1.5 years ago. And we'll get into a little bit about the different levels of care, but we fall kind of in the middle, where it's less intense than a residential program, more intense than traditional outpatient therapy. And so someone would come to us and they'd be either in partial hospitalization or intensive outpatient, which is just a fancy way of saying all day, every day, or half days. And so, you're going to be getting somewhere between 12 and 30 hours of treatment per week. And that's going to be, oversight into your medical treatment with our doctor and our nurse. It's going to be individual therapy. It's going to be group therapy. And so, it's one of the things that we're going to talk about today a little bit is, last week we talked about what is therapy, and this week we're talking about what is treatment. And one of the big differences between treatment and therapy, well, you get therapy in treatment, so it's kind of a subset. but treatment kind of implies a little more intense experience with multiple members of a treatment team supporting you, whether that's through therapy or medical support or whatever that might be. But it kind of all comes together with a group of people as opposed to just, your one individual therapist that you might see weekly or monthly.
Right. It's the big picture. So, what are the different levels of treatment?
Yeah, so within treatment, we have what's called a continuum of care. And the continuum of care goes kind of from most intense to least intense. And so at the beginning, at the most intense level, you have detox or detoxification, right? And so that's a heavily medical experience that is designed to help someone come off of a drug of choice safely. So there's going to be medical monitoring. You're going to be living there. They're going to be, they're going to be providing medications to prevent you from having a seizure. And so it's a little more of a medical experience. But they're going to start introducing stuff like group therapy. So start to get a little bit more of that. And then residential is the next step, and that's what people think of as going to rehab. And so this could be mental health or it could be substance use, but you're living there and you're having programming throughout the day. And then at night you sleep there. They might integrate different experiences at night, whether you go to a meeting or watch a recovery related movie and write about it, whatever that might be. But that's your residential inpatient experience. And then the next is where we are, which is, I mentioned, PHP and IOP, which is outpatient, but ranging from 9 to 12 hours a week all the way up to kind of 30 hours a week, but you live at home or at a sober living facility. And then finally after that you have outpatient, which is kind of what we talked about last week with what is therapy.
And you're listening to Healing Your Life with Sophros Recovery. We're here with the CEO of Sophros Recovery and also the Director of Customer Relations. And if you are listening and you think you might have just questions or you're in that detox phase that we were just talking about and you need immediate assistance, you can call Sophros, and their number is 904-439-4805. Again, that number is 904-439-4805. If you're just in the discovery phase or you have a loved one or a friend that you just want to see if Sophros Recovery might work for you in your situation, you can check out the website, sophrosrecovery.com. So we also, like I said, Nick's been talking here about the different types of treatment, different levels of treatment, and you offer outpatient. So Elaine, I just wanted to talk to you a little bit about what you might have to add just about customer service when it comes to different levels of treatment, or what anything you might have to add about that.
Well, I definitely sorry. See, I'm doing it again. I definitely talk to each client when they call into me, and there is usually, I ask a series of questions to them just to kind of see where they're at. I kind of like to find out a little bit about their situation. So I will ask a lot of series of questions, so where are they at? Are they drinking? How much are they drinking? Are they binge drinking? So to kind of find out if they need to go into more of a detox setting, are they at potential for having seizures? Do they need to go into residential? Do they currently work? Are they able to get off of work? So, we do have our day and evening programming, but maybe they do need to take FMLA. So we can kind of help with that paperwork if we need to. But we also provide a free assessment at Sophros. So they can come into our facility if they're really not sure if they need to take time off from work. So I just like to ask a series of questions and kind of go from there.
Right.
And meet them where they're at.
Yeah, I mean, that is all very relevant information and so helpful, Elaine. So you're basically answering the phone generally when someone calls, right?
Yes, I'm usually their very first contact when they call in. And so I kind of, like I said, find out what their story is and really listen to them. I think I really make a connection with them on the phone. And then, of course, I will email them the virtual tour, the brochure. I kind of, what does your first day look like when they come to Sophros? So I kind of paint a picture. So because a lot of people are very nervous, they're scared, they've never made this phone call before. So they're really not sure what to expect. So I try to take some of that fear away. And so it's not so intimidating, and I kind of reassure them when they do come through our front doors at Sofros that it's a very safe environment, and that when you meet the staff, you know, you are really you meet such amazing people and you feel at ease. So we, even if they're not sure if they need detox or res, the staff really meets them where they're at and helps them to make a decision that's in their best interest, so they can have the best recovery possible.
And that's so wonderful to know, Elaine, that you're there to walk them through that process, because maybe you don't even know what questions to ask, right? Or how am I going to pay for this? Or do I even need help? Or does my loved one need help? So, Elaine, you're just so wonderful in having those tools, you know, that you have acquired over the years to understand how to talk to people about this. So it's so comforting to know that Elaine is there when you call. The number, by the way, for Sofros Recovery is 904-439-4805. Again, 904-439-4805. And that's generally how Sofros answers your questions initially, is through a phone call. And they're ready 5 days a week, 7 days a week, Nick?
Probably. Elaine answers the phone 7 days a week for sure.
So they're there if you need them, and they'll get back to you and make sure that you have all the information you need that we just discussed. So quickly, Nick, if someone is trying to make that decision, if they even need treatment, what is, I know that you gave me kind of a quick scenario last time, like if you don't know.
Yeah, and it's really just picking up the phone and calling. Even if you call the wrong person, I mean, we'll help. For example, if you call us and you need detox, we'll help you get detox, right? We're not going to try to put someone into the wrong level of care. And so, you know, finding someone, reaching out to someone, whether it's us or someone else, and just saying, here's where I'm at. Is this something you guys can help me with? If not, who should I talk to? And so not being so worried about getting it right, because we see this every day and we know what questions to ask to determine kind of what level of criteria, you know, do you meet the criteria for what level of treatment? And so rather than trying to figure that out yourself, it's just call someone, even if it's the wrong person, and just, you know, answer those questions that Elaine or whoever answers the phone has.
Right.
So they can point you in the right direction.
So when we come back from the break, we'll talk a little bit more about exactly how you would know, or how you can figure out what level of care you might need. Obviously, we kind of cover that as far as if you don't know, that's okay too. You're listening to Healing Your Life with Sofros Recovery. We'll be right back. Welcome back to Healing Your Life with Sofros Recovery. We're here with the CEO of Sofros Recovery in Jacksonville. His name is Nick Padlo, and also the Director of Customer Relations. Her name is Elaine Simpson. And we want to launch back into the topic of exactly what level of care someone might need if they are seeking help for recovery from addiction, and how they would know that, Nick.
Yeah, so as I mentioned before, always feel free to just ask someone, a professional in the field, and they can help direct you. But I think that the first question that you should be asking yourself is, one, can you stop using or drinking for a few days? Can you stop? Can you stop safely? And then also, can you stop just, you know, are you able to stop? If safely, are you able to stop, I guess is the way that would work. And then also from a mental health perspective, are you safe? Are you safe? And are your loved ones safe? Are you going to be okay? And if the answer to any of those is no, if you say, I can't stop for a day or two, or you say, I could stop, but I'm concerned about, you know, these side effects that are really extreme right now, and they're intense, and so you probably need detox. If you say to yourself, well, I think I could stop safely, I don't, you know, depending on, some drugs of choice are more dangerous when you stop. So like benzodiazepines and alcohol, for example, you can have very serious seizures. You know, with opiates, you're going to have an intense amount of pain, physical pain, and sickness. And with some of the others, there are, you know, potentially, like cocaine, for example, has, you know, less detox withdrawal effects, right? But you say, I could stop safely, but I just can't stop. I can't drive past the liquor store without stopping in. I can't go home at night and not have a drink. Then you probably need residential treatment. If you say, I can stop for a few days. It's safe for me to stop for a few days medically. And I would ask medical advice on that. But if you say I can do that part, but I just kind of keep falling back into these old habits, I can go 3 or 4 days. I fall back into the habits. I think I could make it a week, but that's really about it. Then you could probably come see us or someone at the PHP IOP level of care where you say, it's safe, I can do it, but I can't keep it up. Then that's where PHP IOP comes in. And if you say, well, I just have, I'm drinking once a week or occasionally I'll go use and I don't have a healthy relationship with it, but I need to work on my mental health a little bit, then maybe that's when you seek outpatient treatment. But what you don't want is when you fall into one of these more severe buckets to try to treat it with less care than what you need. And what happens there is we use the phrase putting a Band-Aid on a bullet hole. You're going to be kicking the can down the road, and though unfortunately you're just not going to see any improvement because the level of care that you need is just higher than what you're getting.
Right. And so I know, Elaine, we were talking about how you take a lot of these phone calls. What generally are the first couple of questions people are asking you? I mean, I'm guessing they come in all different states when they call you.
They absolutely do. I mean, I see folks that come to me and say, my marriage is in a shamble. I know it's because, I'm have a substance. I'm drinking. I want to be a mother or a father to my kids. I do see all types of folks, and I love seeing when people call me and then I see them go through our program and see that they've got their lives back. I just really love seeing them progress and happy and just being able to enjoy life again, and being able to hold down jobs and see their kids. So I really do see all types of folks, and I definitely direct them to the right fit. If they need detox. I definitely have a lot of contacts out there in the community, so I'm able to refer them out if we're not the most appropriate place, but knowing that we are a great step down place after they get down, after detox and res as well.
Right. And you talked about a couple of different situations, and that's all we're really looking for. And to come to that revelation that you need help is such a wonderful revelation, first of all, to pick up the phone and make that call. And then to be able to kind of envision that in your head. What a wonderful thing to possibly repair your relationship with your children, with your spouse. Wouldn't that be fantastic? With your partner. So if you are at that point in your life and you think, I just need to do something about this, I'm going to call Elaine. Her number is 904-439-4805. Again, 904-439-4805, and that's the number for Soft Roast Recovery, and this is Healing Your Life with Soft Roast Recovery. And we wanted to move on now to what should we be looking for in a treatment center once we make the step of saying, okay, I need help. How do we make sure it's a safe place, a clean place, a good environment, Nick?
Yeah, so it's really hard when you've never been to treatment before to know what right looks like.
Mm-hmm.
And so what we tell people is the first thing to do, I mean, thankfully now we have the internet, right? And you can look and see what a facility looks like. You can see the things that they talk about on their webpage, right? Are they, are their clinicians master's level clinicians, right? Do they focus on cognitive behavioral therapy and dialectical behavioral therapy? And even if you don't know what those things are, just knowing that they're at least talking about it as part of their programming can be helpful. Do they work with trauma? And especially if you have significant trauma, that's going to be important for you to know. Is that something that they specialize in? And then also, is this a place that you can financially afford? What insurances do they take? What insurance do you have? And so there may be trade-offs where you say, well, I'd love to go to this facility, but this one takes my insurance. What do I do here? And so that's something that, I recommend people discuss with their family because, whether it's money or whether it's kids or whether it's work, there are always going to be barriers to treatment. Right. There's always a reason not to go to treatment. The only reason to go to treatment is to get your life back, right? But what we always say is anything that you put in front of your recovery, you're going to lose.
Right. And I saw Elaine was just ready to talk about this one. So when people call you, I'm sure you're ready to brag about Sophros, because I've been there. It's a wonderful environment. The minute you walk in the door, you feel at ease. And the minute you meet the people, you know you're in the right place.
Absolutely, and Nick hit on a lot of those things when you are trying to pick the perfect treatment center. I personally have made it a mission of mine to visit a lot of residential facilities down in Florida and even Georgia as well. So when they reach out to me and I know we're not the right place for them right away, I'm referring to them to a place that I have visually seen. I can speak for it because I think it's a reflection of us as well, that we want to make sure they get to a very safe and safe place. So again, knowing what their insurance is, if they are into 12 steps, are they a dual diagnosed place, are they veteran friendly? Those are all things that we want to take a look at when we're referring to other residential facilities. And when they do get out, do they need a sober living to go to as well? We don't provide sober living, but I also know other sober livings out there that we can work with. So
Right.
I've also visited those places as well.
Elaine, that's such a great point, because I know, from experience from calling around to different places, that sometimes that the place you're calling is great, but then to trust the references is something different altogether. So to know that you put that much thought into it is so nice for people listening to hear, because you over and over make the point, Nick. I mean, this is your business, that you're more than willing to just get the help that people need. I mean, that's your main goal, right?
Absolutely. I was in this place myself, right? And the treatment industry as a whole, has had a bad history, had a bad track record for a while of people kind of just trying to run it too much like a business. And while we are a business, we're a business with a mission and a vision to help people regain their lives. And so whether that's us or somebody else, I mean, it's indifferent to me.
Right. And you often ask me to make that point, just so listeners
Right.
know. Say, listen, I want to make sure they know if they call us and Sophros is not where they need to be, we're going to let them know where they can be. And it's so comforting to talk to Elaine today, because you have visited these other places and you know that they're on the same level as Sophros. So that's really, really comforting. And so we want to talk a little bit about how does someone actually get help, and we're going to launch into that after the break. But initially, if you want to get a hold of anybody at Sophros Recovery, I'll give you the number right now, which is 904-439-4805. Again, 904-439-4805. And Nick, if they go to the website, what are they going to find there?
On our website, there's an addiction blog that we have a lot of different articles posted that can be resources. You can learn a little bit about our team members. You can see our facility. There's also a virtual tour on there, which kind of gives you a feel for not only what it looks like and how it feels, but also what we do. And so yeah, there are a lot of resources on the webpage that can be helpful in kind of just starting to understand what this whole treatment thing is, and demystifying it a little bit.
Right. And so if you want to visit the website, maybe you're not ready to make the phone call just yet, and you're doing initial research. The name of the website is sophrosrecovery.com, and Sophros is spelled SOPHROS recovery.com. And that's a great place to start. They have a beautiful website where you can see all of the staff members on the website as well, if you're wondering what their qualifications are and if that would work for your situation or your loved one's situation. All of that information is on there as well, and you can actually see the facility. It's beautiful, it's comforting, it's warm, it's welcome. And so we are going to be right back and talk a little bit more about how do you get help for yourself or someone else, and who would you actually call about that. And we're talking today about how to get treatment, types of treatment, and how you can get help with Sophros Recovery. This is Healing Your Life with Sophros Recovery. You're listening to Healing Your Life with Soft Roast Recovery. I'm April Davis here with Nick Padlo and Elaine Simpson. Nick is the CEO of Soft Roast Recovery, and Elaine is there as the Director of Customer Relations and often will be the person answering the phone if you do give them a call. And we did talk about who do you call. Well, obviously, you call Soft Roast Recovery. I'll give you that number right now, which is 904-439-4805. Again, 904-439-4805. And Nick, we were talking about the levels of treatment and what that entails, but how long is a commitment to this? Say, like you said, there's always a reason that we can come up with why we wouldn't want to get treatment, but how, and once you make that decision, I think however long it takes is worth it. But it is good to explain to folks how long each treatment takes.
Yeah, and I think that when we talked about this, we said, okay, well, what level of care do you meet criteria for? So where should you go? And it's really, the question is really not where do I go, but where do I start in the process, right? And so if you start at the point where, okay, I need the most intense level, I'm drinking every day, I'm using every day, I need to make sure that I come off of this safely as a first step, and I need to go to detox. Detox can last anywhere between 5 days and 21 days, depending on where you go and what your drug of choice was. And so that's the detox period. But at that point, you should still be looking at, okay, what about the next level of care? Do I then need to go to residential treatment to really start to build that foundation with your mental health and with your recovery? And so that's going to be probably around 25 to 30 days in residential treatment. Now we've done detox, we've done residential treatment. Now it's time for PHP, IOP. And so all of the residential treatment centers in town and us and every professional will tell you that the best way to do that is you go door to door. You leave the residential treatment facility and now you're going to start the next step. And that's the way that, that's what is proven to have the highest efficacy, when it comes to long-term recovery. And so, PHP at that point, partial hospitalization is going to be 2 or 3 weeks. IOP is going to be another 8 weeks, and that's the 3 hours a day. And then, after that, we're talking about AA meetings, we're talking about smart recovery meetings, we're talking about going to see your therapist periodically. But all in, if you start at detox, you're talking about a 4-month process. And I know a lot of listeners are probably saying, well, that sounds crazy. I can't afford to do that. And the real question is, can you afford not to do that?
Right. How much time do you have left if you don't go to treatment?
What are we going to lose in our life? If we say, oh, I can't spend, 2 months away from my kids, but what if this disease and this addiction causes us to lose our kids, or for their kids not to have the father or mother that they deserve? And I think that's really, when we start to ask those hard questions of like, what is the cost of going to treatment, but what is the cost of not going to treatment?
Right. And it could obviously ultimately be the end of your life in one way or another. It could be death. It could be you get in some terrible accident, or it could be that you hurt someone else and you have to go to prison, or it could be that you lose the love of your life, or you lose your children because of addiction. So those are things that you have to kind of weigh and say, what's the most important thing to you?
And we always said, I think we said it in the first episode, I don't know if they said it last week as well, but all of these things, when we're dealing with mental health and when we're dealing with substances, all of these things are yets.
Right.
I haven't lost my job yet. I haven't lost my kids yet. I haven't lost my wife yet. But this is a progressive disease, and if we don't start to do something about it, then a lot of those yets start to manifest, and we look back and now we've got, DUI, and we've got a strained relationship with our family, and it's like, all of that could have been kind of circumvented had we, if we can make this tough decision, we can prevent these yets from manifesting.
Right. And we all know anything worth having, it takes time, and sobriety is worth having if you have an addiction issue. And I know Nick can attest to that, and anyone who's come through on the other side of sobriety will tell you that it's absolutely worth it. 4 months will seem like nothing at that point. And so if you want to talk about that with someone, you can absolutely call Soft Roast and just see, can we take the first step, the first day, the second day, the third day, and just take it one day at a time. And you can call them at 904-439-4805. And it doesn't cost you a thing. It just is a conversation to get you started on that road to recovery and healing your life with Soft Roast Recovery. And we want to talk also just about the complete journey we talked about the timeline, but people do need to envision, what is this all about? How do I get started, and what can I look forward to, Elaine?
Well, the first step is knowing that you want help, because you gotta want the help. Not that your wife or husband wants you to get treatment. You want that help. And once you make that decision, you can call me, you can text me, you can email me. I can put my cell phone number right out there for anybody to call. My cell number is 904-534-0987. I know a lot of people will say, you know what, I work and I just don't know how I can attend the program. That's a huge commitment. Just so everybody is aware, we do have day and evening programming. Even if you have a split shift at work, we can accommodate that schedule. We can, if you want to come 2 days during the day and then attend a day in the evening, that's perfectly fine. We're going to accommodate you to get the help that you need so much. So once you pick up that phone, I get the basics from them. Where are they in their journey? But if I know that I can definitely help them at Sophros, I kind of find out, what insurance do you have? I will run your insurance. And while you're waiting for me to get back to you within that first couple of hours, I will ask you for your email so I can send you a brochure and virtual tour of the facility. I will paint a picture of what a typical day looks like at Sophros. And I will definitely call you back and let you know what your deductible looks like. We do not take Medicare and Medicaid, but I still have people out there that I can refer you to if you do have those types of insurance. Even if you have TRICARE for Life, we can do a Medicare opt-out letter. So always call me. I am full of knowledge out there, and I can get you to whatever place that you need to be.
Excellent. And so I also think it would be helpful just to touch on, if they come to Sophros and decide, okay, I want this treatment, what does that look like? Is it just one-on-one therapy, group therapy?
So a day in the life of Sophros. So say you join the partial hospitalization program, so the full day program, and the half day is just the first half, basically. You'll start out with an hour of group therapy, and that group therapy is going to be what's called a process group, and so it's a little more open format. It's like, what's coming up for you today? What difficult emotions are we facing? Has anyone struggled with a relapse recently? Let's talk about it. Let's work through it and try to understand why that happened. And then throughout the day, each hour is going to be a different topic, and that might be relationships and communication. That might be, how do we start to regulate our emotions? It might be, how do we start to reframe unhealthy thoughts into healthy ones? We have music therapy as well, that comes in once a week. And so we're constantly trying to kind of change explore different modalities in different areas in our life where we need to start making some improvements, so that we don't feel the need to drink or use or escape in the first place, so that we start having better relationships in our life, and so that we start being able to kind of control our emotions rather than being controlled by them, right? We can experience them, but they're not driving the bus. We're driving the bus, and we acknowledge the passengers. Yeah,
and I know you have lots of qualified people at Sophros, and you were mentioning earlier, and I thought this was an interesting point to make, that if you are looking for therapy, use some big words, and I need to revisit something that started with a D, qualified person. What would you be looking for specifically if you are looking around? What specific things should you be looking for a quality place for addiction recovery?
Yeah, so I think having licensed clinicians, having master's level clinicians, whether that's LCSW or LMHC, that's probably not as important as the fact that they have some credentials. You want people, like I said, that are certified in trauma, potentially that are doing things like ART, like accelerated resolution therapy. And then if you see that, you can go research, what is that? Maybe that's something that's good for me. Or EMDR, which is dealing with eye movement. But what you want to see is some specialties. You want to see an emphasis on CBT and DBT. I'll just make it easier using the acronyms. But these are just different modalities that are proven to be very effective across a myriad of mental health conditions as well as substance use. And so you want to see that people are using those evidence-based treatments.
And so I want to get the phone number out. We've talked about some really great stuff today and what you should be looking for if you're really trying to get addiction recovery for any substance, anywhere, what you should be looking for. Sophros has all of those qualifications that you're looking for. They have experts in the areas that can help you here in Northern Florida and make sure that you get on the right track. And if their facility is not the right place for you, Elaine can direct you to the right place for you, and she's checked them out herself. So give her a call at 904-439-4805. Again, 904-439-4805 for Sophros Recovery here in Jacksonville. And I just want to end this by talking about, okay, once we get through the 4 months, once we get through the tough stuff, at the end of the journey, what do we have to look forward to?
Yeah, I'm glad you asked that, because I was going to try to segue into that. You know, we've talked a lot about all of these things that we're going to need to do to get our mental health back on track and to be sober. But what does that look like? What is that experience? You know, and I've been through treatment myself. I've seen other people go through treatment, and so often when people come to us, they're just broken. You know, their lives are broken. They seem broken. Their affect and their mood is down. Their shoulders are slumped. And, you know, after a couple weeks, you start to see the shoulders go back a little bit. You start to see the eyes perk up. You start to see some clearness in the eyes, right? All of a sudden, you're starting to sleep again, right? And you're starting to rebuild relationships with your family, right? And so you're physically, your body is starting to heal. Your mind is starting to heal. Those bad days that we used to have, well, now there's less bad days, and the bad days are less bad. And so we're decreasing that frequency and the intensity, and then we just keep doing it. And it's still going to be hard. As going back to Aaron, humaning is hard, right? And we're all going to have bad days, but we don't want that to be every day, and we don't want it to be awful, right? We want to minimize the suffering that we do in this life, and, you know, maximize the living that we're doing. And so, you know, by the end of treatment, you know, you see someone that came in 3 or 4 months ago and had been unhappy for 10 years. And now they're just this, you know, ball of sunshine, you know, and It's like, life isn't perfect, but it's a heck of a lot better than it was 3 months ago. Right. And I'm not being controlled by a substance. I'm not being controlled by negative emotions. And I'm starting to be able to put words to my feelings and thoughts and communicate better. It's a whole different person. And it's probably like my favorite thing to see at Sophros is like this change in people from the beginning of treatment to the end. And you just look at me like, that is a completely different person. And it's not. There was just too much stuff in the way before. And so we had to kind of, you know, one of my teacher's favorite words is he talks about discover. And people always think about discover as like, you know, going out and finding a treasure that's hidden somewhere. But if you think about the word, it's just discover. Just take the cover off, right? Just remove the cover. And so all these things, these mental health challenges and these substances, we just start to take them off. And the person we always were is always been there. It's just been clouded in all these things. So we'll help you do that.
Thank you, Nick. Thank you, Elaine, for joining me today for Healing Your Life with Sophros Recovery. It's been a wonderful conversation. I love the talk about the transformation. If you're ready to make that transformation and get out of your cocoon and see how you can develop into a beautiful butterfly and end the struggle with addiction, make sure you call Sophros Recovery. Check out their website, sophrosrecovery.com, or just give them a phone call, 904-439-4805. I'm April Davis. Thank you for joining us today for Healing Your Life with Sophros Recovery.